Hey guys, we're going to start talking about the muscular system this week. There are over 600 muscles in the human body. There's actually a little disagreement in the medical field with how many muscles are actually in the body. Most people say around 650, but there are those that go well over 800. So for our class, we're just going to say over 600 muscles. And we're going to focus on skeletal muscles in the human body. So there are three types of muscles. There's cardiac, which is your heart. Smooth muscle, which would be your internal organs such as your liver, stomach, pancreas, intestines. Those are smooth. Those are all involuntary. And then we have skeletal muscles as our third type of muscle. So we may ask you what the different types are on a quiz, what that would classify as. So just pay attention to that part of it for the quiz. And then more specifically, today I'm going to work on the upper body. Just talking about those muscles and very specifically what exercises that we would use those for. So it might, if you have a piece of paper, some notes, you might take some of that stuff down. So I'm just going to start really at the shoulder area. We've got one other muscle that when we get to the back, I'll show you that's above that. So number 14 here, so I've got this chart over here on the side, is the deltoid. So there are three different sections of the deltoid. There's anterior, medial, and posterior, which you don't need to know. But if you just talk about the deltoid is something that we use in a shoulder exercise. So anything where you're actually lifting overhead, you're going to feel that muscle here activated. Anything where you're throwing, that actually helps stabilize the shoulder as you're going as well. So the deltoid is an important muscle complex for anything that we're doing overhead. Number 15, right here in the middle, is the pectoralis muscle. And there are actually two of them, but for this, we'll just call it the pectoralis. And this muscle is the only fan-shaped muscle in the body, which it's interesting if you actually, when you go to stretch this, which if you were to lean against something, if you raise your elbow up or down, it actually changes the area of where that muscle gets stretched. So that muscle is going to be used primarily for us when we're doing any kind of chest exercise, such as a bench press, a push-up, anything where you're pushing in general is the primary muscle is going to be your pectoralis muscle. All right, and then as we move downward here, we have our abdominals here in the center. So your abdominal muscles are they might be the most important muscle to any kind of athlete or really in our human body. It helps generate our balance. It helps make everything around it stronger. So if you think about a house having a foundation, something cement that it's sitting on, it's going to help keep it upright. If it doesn't, it's probably going to get blown over. So your body can kind of be the same way. If your abdominals are weak and you're strong everywhere else, you're probably not going to be anywhere near as strong as you could be. But if your abdominals are very, very strong, you're going to be able to maintain balance and then create a lot more strength around that because of that. 18 is the extension of those. It's your oblique muscles out here on the side, so that kind of goes hand in hand here. These muscles play a big part in our body, and they're both really, really important. Moving up over here, 19 is our biceps. So that's any kind of contraction where you're bending that upward. This is usually an assisting muscle. It's generally not a primary muscle. Now, if we do bicep curls in the weight room, we can make it a primary muscle. But for most anything else that we're pulling or something where our primary is going to be a muscle on our back, our biceps are going to be assisting in that regard. So we're just going to kind of focus on those there on the front part of our upper body, and then give me just a second, I'll turn around to the back. All right, so here we are with a view of the back of the body. So I'll just start up here on the top. So number 6 is our trapezius complex here. So if you do a shoulder shrug, things like that, where you're actually raising your scapula or your shoulder blades, that's where that trapezius muscle is going to get impacted there. So and then if we go down here on number 8, it's actually hiding underneath. This is your rhomboid. They have an interesting name for it over here, but rhomboid here is what that is. that's going to be the major muscle, or where that is a primary muscle, is anything where you're doing a pull exercise. And I'll just kind of stand. So you guys have seen any kind of where we're pulling a band back or we're doing a row. That is going to be the primary muscle there, and then our biceps are actually assisting on that. And then kind of coming down here, number 13, which is our latissimus, or it's our lats. That's also a pull, but usually it's pulling downward. So if you've ever done a pull up, or you're doing a row where it's more coming downward, we're bringing down, biceps are assisting again because it's a pulling exercise, but the primary muscle there is going to be your lat muscle. Interesting thing about that, it actually wraps around and attaches to the front of your shoulder. So it's a very unique muscle that we have there. On the back of our arm is our triceps, so that's number 12. That's the opposite muscle of the bicep. So we mentioned earlier on the pectoralis muscle, where we're doing some pushing, the assisting muscle is going to be the triceps on that particular exercise. Now, if you're doing a chest exercise, the closer your hands get together, if you're doing a push-up, the more tricep that you're actually using, and then the further apart that you get, the more chest that you use on that exercise as well. All right, and then the last muscle that I'm going to spend some time on here is just going to be number 21. So it's your erector spinae muscle. It's a really big stabilizing muscle. We talked about this last week with the squat. That's an important muscle that we don't want to fatigue. So the interesting thing about our upper body is we a lot of times create injuries up here because we are trying to lift something too heavy. Generally speaking, the guys struggle with this more than the girls, just because the amount of weight that we lift. I think sometimes we tell ourselves a message that it's important that we appear to other people that we are stronger than maybe even than we are. And so we're willing to lift heavier weight, even if it might mean we get injured, which is honestly probably, well, it's not intelligent, but it's kind of how guys' brains operate at times. So what happens here on this particular muscle at 21, for example, if we're going to do a bicep curl, where on a bicep curl, I want to keep my upper body straight and tall and not have to move my back. But a lot of times when someone is doing a bicep curl, it's too heavy, they will pull back and they're putting pressure on that low back area. Or if we're bending down and picking up too much weight, this muscle really gets activated, and if it's not capable of handling it, then our skeletal system and discs end up getting messed up in there as well. So those are a few muscles that we're just going to talk about this week on the upper body, and then we'll get into the lower body later on in the week.